Okay, Alicia, thank you for joining me. And you're from Renew Massage Studio, correct?
Correct.
Yeah, can you give us a better idea, uh, a little more about Renew as well as how you got
Sure.
into massage?
Sure. Yeah. Renew Massage Studio, we've been around. Actually, I started it over 10 years ago now, but when we started, it was just kind of me in an office seeing clients and expanded since then, just kind of throughout the years as we got more and more clients, started kind of taking over offices next to us. And then we're in our beautiful Bonnie Bray location now with 5 treatment rooms. And then this summer, we actually expanded and opened our second location over here in it's actually on Youngfield, which is right kind of the cusp of Golden and Wheat Ridge. So really close to I-70 and more Western Denver area. So
Oh, okay.
yeah, but so we have our 2 locations now. As far as massage and just kind of my history with massages, I have been doing massage all my life. Really, my dad was really sick as a kid, and we used to massage him as like the one thing that really helped him like feel better. So we kind of were doing it as a family, and then went to college, got a health science degree. Really didn't know what to do with that degree, and just went to massage school kind of on a whim, and I've just loved it ever since. So I've been doing massage for I think since 2006. So that's kind of where it all started, but I'm really just passionate about alternative healthcare and helping people with whatever they need help with, whether it's stress relief or pain relief or anxiety, or just wanting to let go of the chaos of the day and come in and get a massage. So that's kind of where Renew started. And yeah, since going to massage school, I mean, it was just life-changing. It was such a neat experience, and been doing massage ever since. So
Okay, great.
yeah.
Well, that probably is a good prelude with the years that you've been into massage. But I have a question because I've heard this before myself, but what are some of the misconceptions around massage that you've
Sure.
heard?
I think, this is a great question because a lot of people think massage is just like something that you do to pamper yourself. And I feel like we get that a lot, and it's actually the complete opposite. It's not something that, you should just do once in a while. And it's not really, we don't consider it a pampering thing. We actually really consider it a therapeutic modality. It helps with so many things. And I think that might be an issue that some people don't realize. Some of the biggest things would be obviously pain relief, tension relief, injury. We get people that come in with major injuries that need surgery, and sometimes the massage can really, like regular massage and alternative healthcare, can really help prevent having surgery for certain injuries. But yeah, we call it therapeutic because we really focus on what the client needs, where they're at, meeting them where they're at, whether and it might be that they do need some pain relief, they do need some tension relief in the muscles, but they also may need stress relief, emotionally. And I think that massage is a huge aspect to that. Just emotional self-care, which, life has been crazy this last year and a half. A lot of people are struggling emotionally. It's been between the shutdowns and COVID and just all of the changes and just kind of trying to make it through and survive. Massage has really been helpful for people to take a break and relax. I think you don't realize sometimes what you need mentally, physically, to kind of get out of that chaotic day to day, which is just very busy all the time. So massage, not only does it help with the pain relief and that side of, more muscular side, but that emotional stress reliever as well. And I think, you don't have to get a massage. You don't have to have an issue to get a massage either. You don't have to have an injury or something like that, or be an athlete to get a massage. I think it really helps everybody on such a deeper level, physically, mentally, everything. And it should be part of everybody's self-care. I mean, we always recommend come in every month for a massage. It's like monthly maintenance. And it really helps a great deal.
I
So,
couldn't agree more. Yeah, great.
yeah.
Awesome. So it sounds as though with your Bonnie Bray location as well as Youngsfield location, it sounds like you have multiple rooms. So I'm assuming you're not in both locations at the same time, per se. So
No, not me.
you have multiple therapists working for you?
We do. Yeah, we definitely have a bigger staff over in Denver. We've got just a bigger, more treatment rooms down there, and that's kind of that location's been going for much longer. Obviously, this one just opened a few months ago. So, but we do have staff at both locations. The Denver one is usually pretty booked pretty quickly, but we do have a little more openings here, I would say, in Golden, just because of just being a little bit newer. But yeah, we do have staff in both spots. Our staff are amazing too. We're really picky when it comes to interviewing, and we just don't hire people that we don't think can do given a really incredible massage. I think that's like a really big part of it, is that we make sure the therapists are just awesome at what they do. And that kind of, I don't know, I think helps us stand out.
Excellent. Yeah, that was a question I had. What are some of the techniques, or what are the things that may separate you from other massage clinics?
Yeah, I think, the fact that we kind of call our main kind of regular massages therapeutic massage. And the reason we call it that is because everybody kind of comes in for a different reason, and we don't want to lump everybody in the exact same situation. What we do is make sure our therapists are really good at communicating. And then, it's all about, what does that client need? What are they coming in for? And our therapeutic massages are really focused on the client, the client's needs. Do you want a full body? Do you want a focused work on your neck and shoulder because that's your tension area? Do you need some hip work today? Do you want more of a relaxing? Do you want more of a sports? Do you want more deep tissue? All of our therapists are able to do deep tissue, so that if that's something that they want, they can easily combine it. It's not like you have to pay extra for deep tissue or have a separate service. It's all under that therapeutic massage category. And our therapists are unique. Everybody kind of has a different skill set. So we always encourage people to go onto our bios, like on the website, to kind of look at the therapist and find one that maybe would be a better fit for them. Or we also say reach out, and we'd be happy to kind of suggest someone that we think would be a good fit based on what a client might want. But yeah, our therapists are incredible. They truly are. They are the reason why our business is so successful. And I really think it's a huge part. They're not just employees. They're our new family. So our therapists, though, are very good at what they do. They have a lot of different abilities. And we do offer some cool additional treatments besides just therapeutic massage, like cupping, which has become really, really popular, especially for a lot of athletes or people that are, kind of do more sports or have tighter muscles. You don't have to be an athlete to do cupping, but so we offer that. We also offer the Himalayan salt stones, and that just adds warmth. The stones are pretty cool. They've got some awesome properties just for like detoxing in the minerals, but the heat from them, and we use them to massage, and that heat can be really good for opening up the muscles. We do prenatal massages too for those that are pregnant, and we have, all the therapists that do it are properly trained and have all the correct bolstering and pillows and everything, so it's safe, because that's a great thing to do when you're pregnant as well, just to relieve some of that tension as you're growing a baby in there. So
yeah, definitely.
We offer CBD enhancements. If you wanted that, sometimes can be really good for extra anxiety relief, extra pain relief. And then in our Denver spot, we have an infrared sauna, and some people love doing kind of a massage sauna combo to help with detox, boosting your immune system. So
Great.
Yeah.
Excellent. It sounds like you have maybe a different therapist or a variety of techniques to help meet people where they're at. Great.
Yeah, definitely. We try to focus, really on the massage itself, and then kind of offer those additional things. But it's all about, giving an amazing massage, and focusing on what a client might need, because everybody's a little different. So.
Yeah. And I'm not sure if this is a hard question to answer, but is there like several main reasons why you see people coming in to seek massage?
Gosh, obviously we can get anything and everything, but I think the biggest things you probably see is like back pain or neck pain. Like, my neck and shoulders are tight. This seems to be kind of a chronic area. So we get a lot of focus on shoulders, neck, tension in the back, a lot of kind of complaints on low back, hips, stuff like that. But, part of being trained as a massage therapist, you learn about every condition out there pretty much, and how to adapt a session to help that. So if you have an injury, we can accommodate, autoimmune diseases. I mean, even cancer patients, we're all trained in pathology to be able to see really anybody. We do ask for more severe conditions to make sure you're cleared by a doctor to get massage, but most people do get cleared pretty easily. Doctors are recommending massage a lot now to patients in general, just for emotional support, for other, conditions. So,
Well, that kind of preludes into my next question. It sounds like, I'm not sure, but do you guys reach out to doctors to try to coordinate care for some people, or is that something that you guys can do?
we don't really like reach out. I mean, we definitely can, like if someone comes in and says like, my doctor recommended this, I mean, we definitely can work with that. We just don't get that a lot.
Okay.
Like, I mean, as far as, specific doctors saying you should come in. However, we are getting a ton of, doctors referring for lymph drainage after surgeries. We only have one therapist doing lymph drainage right now, but we're hoping to find a few more. So we do offer that. It's just pretty booked right now. So there's a ton of people coming in post-surgical for lymph drainage, and lymph drainage is a little different than massage. It's really, really light work. It's very light touch. It's not a traditional massage in any way, but it can be helpful for swelling and decreasing and kind of just increasing that lymph flow. So, but yeah, I mean, we don't work with a lot of local doctors, but I do know a lot of people are kind of coming in with, those similar things.
Yeah.
So
yeah, I know I've definitely told people when they said they were going to get a massage, like, hey, make sure they work on, say, your scalenes and rotator cuff area or different areas. So that definitely can be helpful when they have a problem going on and they have follow-up work done in that similar area for that therapeutic benefit. So.
Right. And that's helpful when clients come in and say, hey, I think my doctor wants me to focus on this. And then we say, oh, great, that's a great plan. And then, kind of assess too. We always assess as massage therapists kind of while we're doing stuff and see what we see and feel really with our hands, but, and adapt the session even, as we go and communicate, depending on what we feel. But it is nice sometimes if people kind of know what's going on already, but we can still adapt to really any kind of situation.
Yeah, great.
So,
okay.
Yeah.
Well, thanks for sharing. How do people find out more about Renew Massage Studio and get in touch with you if that's something they're looking for?
Yeah, we have a website. It's renewmassagestudio.com. And actually you can, both of our locations are on there. You can call us. We have a special text number if you'd rather text. We kind of try to make it whatever, now modern day, it's kind of, do you want to call? Do you want to text? Do you want to email us? Do any of those is fine. And then we do have our online booking, which a lot of people utilize. And you can just book an appointment directly online, get a confirmation. You can fill out all your forms before you come via the email. So it's we've made it pretty easy to book if you're ready. If you're not quite ready and you have questions, shoot us a message via, phone, email, text, whatever you want. We can help you pick out the right service or whatever you may have questions on. But yeah, but most people kind of go to our website, kind of read, our website, and then they can contact us further from there.
Okay, great. Well, thank you for sharing. I appreciate it.
You're welcome. Yeah. Great. Well, I have a couple questions for you, if you don't mind.
Oh, that'd be great.
Do you want to do a quick introduction as well and kind of
Sure.
Talk about your?
Yeah, I can do that. I've been a chiropractor for about 15 years. And I first experienced chiropractic as a child. I'd slipped and fallen on a rock in a stream fishing and hurt my back. And so my mom took me to a chiropractor, and I was really active in sports growing up, and I'd have some problems every now and then. And my mom took me to the chiropractor again, and I just experienced positive benefits from a young age. And when I was trying to figure out what I wanted to do with my life and my career, I reflected on those benefits I had experienced, and I wanted to pursue that as a career. And as I was there in at the college, in the student clinic, I saw that there was moms bringing their kids in as well. And so that kind of piqued my interest. I'm like, well, they didn't hurt themselves like through a sports injury, or they don't have like a chronic problem. What's going on? And they were bringing them in for like ear infections or, colic or reflux and constipation, or moms were coming in when they were pregnant and they were getting a immense benefit. And that definitely piqued my interest and helped me kind of shape what I'm doing nowadays, which is, meeting, similar to what you're saying, how you meet people with where they're at. But a lot of times with the stresses we're experiencing, our body's been getting beaten down over time. And
Right.
now a symptom just starts to pop up. Maybe it's a chronic symptom. It's been there for a long time.
Sure.
But I've moved away from, say, more of just like injury, pain focused care to, okay, well, let's get you feeling better, but let's get to the actual underlying cause of this problem for you to help your body get stronger and heal better. And so it doesn't want to keep breaking down over time and you lose the quality of your life years down the road, or even currently could be losing the quality of your life. And so that got me into where I'm at now with helping, pregnant women and, people, white collar people working on computers that get headaches and migraines, neck pain, back pain, weekend warriors. And so that's how I got into chiropractic and where I'm at now.
Great. Along the same lines, kind of what is the biggest misconception about chiropractic that you kind of hear, see, or you think?
So I'd say probably the biggest one that I see is that they think chiropractic is only good for, say, neck pain or back pain.
Okay.
And everything is controlled through our nervous system in our body. And like I was mentioning, there's compensations that are occurring in our body, and our bodies are slowly tilting one direction or the other. And depending on how far something goes, it could be, bending over to pick up a piece of paper off the floor, and all of a sudden their back goes out. Well, a piece of paper weighs, very, very little. And that's not causing the injury. The injury was developing for a lot of time beforehand. And so, chiropractic's great at helping with back pain, but people, when they come in to see me, they like, hey, I'm sleeping better. I have more energy. I can focus better. My digestion's better. I'm not having my headaches. I can breathe easier. And so there's all these additional benefits that people can see with the care that we provide here in our office. And as the misconception with back pain, I view myself more as a neurologically based chiropractor because we're dealing with the nervous system that's controlling every function in our body. I'm not looking at it more just from the muscular component standpoint or the bone standpoint, but more from the neurologic standpoint. So the biggest misconception though is just like back pain or neck pain. That's all chiropractors are for.
Right. It's definitely way more than that.
Yeah.
As you kind of mentioned, it's pretty cool. What's your philosophy when it comes to chiropractic? You've kind of mentioned it a little bit, but
yeah, I mentioned that a little bit with it being more, more neurologically centered, where, we want to make sure that our patients, not only are feeling their best, but they can continue to be their best. Similar to, if somebody was to go to their dentist after they've been brushing and flossing every day and they found out they were cavity free and they're like, yeah, right. Then, they don't go home and throw out, like, say, the toothbrush or the floss, and they're like, hey, this is just part of a healthy lifestyle. And people, I think, see the benefit of what our care has to offer them. They're like, hey, well, it's not that you have to go for a lifetime, because I've heard that's a very common thing I hear from people, like, oh, once you go, you have to go for the rest of your life. And that's not at all what I tell people they need to do. There's definitely a start and stop. And if somebody wants to maintain and just like, hey, I feel really good doing this, I want to continue this, then hey, yeah, we can do that too and help you do the best that you want to feel like you can do. And that's definitely up to the patient to help determine if that's the course of action for them. But we'd like to help promote that, just taking care of yourself so you don't become old and crotchety and you can't do anything at a young age.
Right. Totally. Great. So next kind of question, how are you able to help people with things like pregnancy, headaches, chronic neck problems, things like that?
Yeah. Great question, because I think there's, especially with the first part there with pregnancy, women, I think, want to have as healthy and happy a pregnancy as possible, to have like their bundle of joy in their arms 9 months later. And so they've actually done some research on expectant mothers with chiropractic, and they found that there's a 30% improvement or a decrease in 30% of the labor challenges or difficulties or time of women's in labor. So regular chiropractic care during pregnancy can be super beneficial and help create more of a happier home for the baby to sit in, and hopefully find a correct position to be able to have an optimal, easy labor and delivery.
Yeah.
And then with headaches and migraines, a lot of times we see those problems are stemming from the upper part of the neck, especially with white collar workers. They tend to get their head out over their shoulders, they get all hunched, and that can definitely create problems for the nerves that control the blood vessels in the head and neck, or in the head area. And when there's a problem like that, a lot of times it's more in the afternoon, they start developing, say, more of a tension headache, or even migraines can develop as well for some of these people. And then very, very similarly, same thing with neck pain. Oftentimes it's more white collar computer work, and they're not getting the movement they need. And there's other problems that can develop with the neck pain. It can have numbness and tingling in the arms or hands. So they might think they even have like carpal tunnel, but oftentimes the problem's actually coming from their neck.
Got it.
Yeah.
Okay. I honestly wish I would have utilized chiropractic during my pregnancy. It never even occurred to me that that was something that people do, and it was a really good thing. And if I had known even then what I know now, I probably would have utilized it, because I've definitely heard from other pregnant ladies like how much chiropractic has helped, because when you're growing a baby, your body is changing huge, and then just like prepping for labor. So I think that's great.
Yeah.
So what does the first session look like, as a new patient with you?
Sure. Well, typically almost all our patients, before they even come in, I'll get on the phone and do a complimentary consultation over the phone just to see what's going on, answer any questions they have. So it removes any, like, I'll just say this veil of what's going to happen to me, right? What am I getting myself into when I call and I say just talk to a receptionist and schedule an appointment? You're not even able to talk to the doctor a lot of times at certain offices. And I like to make sure I have that open line communication with our patients, so we can see what's going on, make sure it's going to be a good fit first off, so they don't come in with certain expectations and like, oh, whoa, that wasn't what I was expecting. Once it seems like it's a good fit, then we have them come in. We do different nerve tests with them, computerized nerve tests and scans, and different orthopedic tests and all that, and evaluate the posture, see what's going on with them, what their concerns are, and where they want to go, or what they want to be able to do with their goals. And so then from there, depending on what's going on, we go over the next best recommendations if it's received care, maybe if they need any additional tests done, like x-rays or anything like that. And then before we do any treatment, we always just make sure we go over everything so they know exactly what to expect. They're not going to get caught off guard by, oh, I wasn't expecting that, or I didn't want to have, say, like the twisting or popping adjustment, but you didn't tell me what you're doing and you did it. And we have instruments that we can use, so people, we can meet people with where they're at, with what type of care they may want or desire, without, say, rushing into it. And so we get a full understanding of where they're at and what they're looking for.
That's great. Really. Yeah. I like that you do the nerve scans as well. I don't think a lot of chiropractors do that, or at least not the ones I think that's neat. So you can really kind of pinpoint where you're, which bones are affected, or what the nerves are getting pinched, things like that. It's neat.
Yeah.
A question that we get asked a lot is, when do you suggest a lot of people get chiropractic and massage, very close together. A lot of clients ask when would be a good time to schedule a massage, before or after an adjustment, things like that. Do you have any insight on that?
Yeah, I think it can vary depending on where the patient's at. So if somebody is in they just hurt themselves and they're in a lot of pain and they have a lot of spasm in their muscles, then I think a lot of times massage can actually be better beforehand, before getting an adjustment. But if somebody is more in that period where, I'll just say, they're in wellness care, they're not coming in necessarily because they hurt themselves, but they're coming in because they just feel so much better when they get adjusted as well as a massage, then I'll usually recommend that they get adjusted first and then a massage, because now they can be in la la land after their massage.
Yeah, totally.
And just kind of relax the rest of the day, where depending on the type of adjustments they like, it can be, I'll just say, it can actually kind of wake you up and be more stimulating for some people.
Okay.
And so if they just want to relax the rest of the day, then that's what I'd recommend with
Okay.
massage second.
That makes sense. Thank
Yeah.
you.
Yeah.
I guess last question is how do people connect with you that might be interested?
Yeah. They can definitely find us on our website, and that's Denver-chiropractor.com. So like the little hyphen dash, not
Okay.
spelled out, but just the little symbol. And then we also have presence on Facebook, and they can call us at 303-399-3569.
Great.
And yeah, a lot of times we can get people in pretty quickly, within at least a couple days typically, so they don't have to wait too long. And yeah, we're happy to, like I said, to chat with somebody over the phone if they're interested and they want to see more what that first visit would look like.
Yeah, and that's great. You don't see that a lot. Like you said, like you usually can't see or talk to a doctor ever, like when you're making appointments. So that's great that you offer that and really try to make sure you can, help a patient before they're coming in. So I think that's pretty neat that you do that.
Yeah.
Great. Well, I guess that's all the questions that I have.
Well, great. Well, thank you very much. I appreciate your time.
Yeah, thank you as well. This was great.
Yeah. Have a good rest of your day.
Okay. You